Action.
There's a new study now finding no link between a common vaccine and autism. Researchers looked at nearly 100,000 high-risk children. And Dr. Marc Siegel, professor of medicine at NYU Langone Medical Center, and a member of the Fox News Medical A team. Doctor, good morning to you.
Good morning, Bill.
100,000 children. That's a big sample, first of all, right?
Very important.
You would consider that over a 15-year period? That's a pretty long period of time.
That makes it much more scientific.
And what is considered high risk according to this study?
Well, they look at this study at kids whose brothers and sisters, siblings who have autism. And we already know that genetically, if your brother or sister has autism, your chances of getting it yourself is 3 to 10%. So they're high-risk children. And they looked at everyone that had gotten an MMR vaccine, a measles, mumps, rubella vaccine, which is a live virus vaccine, which, by the way, the government tracks side effects on that, and since 1990 has found about 7,000 side effects, none of which have ever been autism. But we watched this vaccine very, very carefully, and the ones that were in the high-risk group that had got the MMR vaccine did not show an increased incidence of autism. Looking at 100,000 kids, there was no increased incidence of autism, no increased incidence of a brother or sister had it. This is very dramatic, and it adds to previous studies and many, many research studies that have never shown a connection between the MMR vaccine and autism. This is the biggest yet.
So you're a believer in this, right? First of all, as a doctor.
Hugely a believer in this.
How does this change the game if indeed this holds up?
Well, I think the game here that we're involved with is trying to calm parental fears, because there's an increased incidence in autism, and parents have a right to wonder why. 1 out of 68 kids are diagnosed with autism now, and we think part of that is that we're on the lookout, but that's not the whole answer. So something in the environment is causing that increased risk. What is it? We want to know. Parents want to know. But my belief is that we've spent so much time focusing on vaccines being the cause that maybe we're overlooking something else that women are exposed to when they're pregnant. Stop with all this money on the vaccine trail, because we're overlooking something else.
But autism itself is still on the increase, correct?
Huge. 1 out of 68 kids.
It hasn't leveled off. It's not in retreat, correct?
We need to diagnose it early. We need to treat it. We need to intervene. We need to be sensitive to parents. But we need to not promote these fears. It doesn't help.
Yet even then, a parent might be watching you right now or reading about this study and saying, "Doctor, I do not trust it." To them, you say what?
I say we had a measles outbreak this year. I say that we have to watch out for measles. I say that we have a public health responsibility to protect others. Now, we also should be looking at the MMR vaccine and saying, should it be bundled together like this? Should it be given at, measles, mumps, and rubella? Should it be given at the ages it's given? How many vaccines should we get at once? All of that has to be studied again and again, and we have to give compassionate answers to parents.
Well, if that's the case, then this is not the definitive answer.
I think it's very close to the definitive answer.
You do?
Yes, but I want more research in a genetic direction. Because, again, it might be that certain kids are more prone to side effects, but there's no evidence that they're prone to autism. And I think, from my mind, it's time to put that away.
Wow, okay,
I think
Marc.
it's a safe vaccine. I think it's an extremely important life-saving vaccine.
Dr. Marc Siegel, part of our medical A team. Thank you, sir.
Good to see you, Bill.